Verizon is a multi-billion-dollar technology company specializing in delivering communication solutions around the globe to businesses and consumers. It is a leading innovator in the tech space. With this success in mind, Verizon has begun rethinking how it does business, with a focus on moving society forward with technology and creating long-term growth by addressing some of society's most pressing issues. Within the company, Verizon's new responsible growth strategy, called Shared Success, focuses on areas within the community that can benefit from Verizon's high IQ networks, people and solutions. These areas include health IT and environmental and sustainability issues, such as its smart buildings and homes. One of the most crucial areas that Verizon is looking at is the healthcare sector.
The delivery of healthcare is going through a revolutionary phase by which the doctor can be somewhere very different from where the patient is. And the patient can be holding the distribution system right in their hand, that is the device. And so right now there are people all over our business thinking through what is the business case for Verizon to enter this whole arena of mobile healthcare, for instance.
Verizon is helping to transform the healthcare system by using healthcare information technology to drive better patient care, expanded access to care, and lower costs. One example of how Verizon is using health IT to modernize the healthcare system is its Health Information Exchange solution. Launched last year, the company's new service allows registered healthcare professionals to electronically and securely access medical data on patients anytime, anywhere. One of the biggest obstacles to sharing patient information electronically is that healthcare systems and providers use a wide range of incompatible IT platforms and formats to create and store data. In fact, many providers are still using paper-based record-keeping systems. Verizon removes those barriers using its network and cloud technology. One of the first services of its kind in the US, Verizon's Healthcare Information Exchange has a very simple aim: to consolidate patient data and translate it into a standardized format that can be securely accessed over the web. Dr. Peter Tippett leads Verizon's efforts to drive technological advancements in health IT.
We call the connection between hospitals or hospital and doctors health information exchanges. If most of the data winds up on paper or on film, and even if it's digital, it's restricted to the one hospital. If we could only share that information with each other, we would wind up with a lowering of cost.
The participating exchange providers can request and share patient data via a secure online portal, regardless of the IT systems and specific protocols they use. This enables providers to obtain a more complete view of a patient's health history, no matter where the data is stored and who the providers are, in an effort to improve patient care and patient outcomes.
Telemedicine is a very interesting aspect of medicine. It is one more step towards making information technology reduce the cost of medicine and improve care. For example, we have a set of hospitals where there's a big fancy hospital somewhere and a rural hospital 300 miles away. And in the rural hospital, the emergency room gets a really big case, like a big highway crash or something, only 2 or 3 times a year. That doctor is a perfectly good doctor. They've got a perfectly good emergency room, but they don't get a big deal emergency every day or 3 times a day. So we've wired it up so that a doctor in the rural hospital can hit a red button on the wall when the big one happens. And the fancy hospital doctor can step into a room and virtually be in the room with the doctor in the rural hospital. Moving a camera around, talking and listening, it doesn't need to be too fancy. They can zoom the camera in and read the x-ray right off the wall, or zoom it in and read the EKG that's lying on the patient's chest.
Here at the University of Virginia, Dr. Karen Ruban is working with telemedicine and is able to help people in rural parts of the country as well as some of the most remote parts of the world.
The University of Virginia has been very fortunate to have partnered with Verizon to help us develop our telemedicine program. The telemedicine program provides global healthcare services to patients in the developing world, but we also provide distance learning and surgical capacity development in Rwanda. We work with a United Kingdom-based charity called the Swinfen Charitable Trust, which provides free consultations to patients in more than 65 developing nations around the world.
Due to several factors, including geography and a high percentage of residents without healthcare insurance, people in Southwest Virginia find it difficult to access the healthcare that they need. In order to help, Verizon has also sponsored a few new ways to reach patients.
We provide clinical services in more than 40 different subspecialties of medicine to patients in rural and remote regions of Virginia, and even in urban areas as well. More than 40 subspecialties provide services, and we are connected to 85 sites throughout the Commonwealth of Virginia. We've supported more than 25,000 patient encounters, and we have saved Virginia patients more than 6.5 million miles of travel to access health care.
Verizon Health Information Exchange meets strict federal standards for privacy.
The type of work that Dr. Rubin is doing is just the tip of the iceberg. For the work we know that can be done with our technologies to advance 21st century medicine. And that really is the core of this entire shared success idea, that based on the values we hold, based on our view of the future, our vision of what a corporation ought to be doing in the world, we can take these technologies and solve big problems. Solve big problems in healthcare, in energy, in education, in public safety. It's pretty darn good for a company like this.